Okay, so we have this 24-year-old man who's had a GHB overdose and needs intubation. I think we've prepped the airway, we've prepped everything. Let's just go through the airway checklist to make sure that we have everything set up.
Sounds good.
So PPE done correctly?
Yes.
Excellent. We've optimized the position?
Yes, happy, slightly ramped.
Good. We have oxygen connected to an outlet and turned on.
Yep.
We have a bag valve mask on the patient. We have our PEEP filter and we have oxygen flowing.
Correct.
Your seal, happy with your seal?
Happy.
And we've got apneic oxygenation prepared.
You prepared.
Excellent. I'll be the team leader. First airway operator.
Will be me.
Backup airway operator, that'll be me.
Mm-hmm.
Airway assistant.
Paula.
Excellent. Are you happy to do external laryngeal manipulation if required?
Yeah.
And we don't need C-spine mobilization for this patient.
Correct.
We have our drug provider here, ready to go.
Mm-hmm.
Thank you. And just a quick check of equipment. We have all of our monitoring on, our end-tidal, our oxygen.
Yes.
Suction's ready.
Suction's ready under the pillow.
We have our video laryngoscope, appropriate size blade.
Yep, Glidescope, Mach 3 blade.
We have an ETT.
Yes.
We have a bougie and an eye gel.
Yep.
We have a D blade and a stylet available.
Available if needed.
And we have a surgical kit should the worst happen.
Yes, it should be in the bottom trolley. We visualized it before.
Thank you. And just double checking you're happy with the ventilator and your ventilator settings.
Yes, and I'll just start with bag valve mask and we'll just reconfirm when we connect.
Excellent. So, you happy with the airway assessment?
Yes, happy. I'm not anticipating any difficulties, and airway plan wise is going to be bag valve for pre-oxygenation, video laryngoscopy. I'll have a direct view. If there's any trouble, I switch to video, and if I'm having issues with video, I'll turn the screen over to you so you can help troubleshoot. We'll aim for sets of 90% as our endpoint, and if we go below that, I'll pull out, go back to bag valve. If we're having issues, we can put in an eye gel as a rescue plan B. But otherwise, if we're temporizing okay, I'll switch over to you as backup operator. And plan D, if we can't intubate, can't oxygenate, will be front of neck surgical cricothyroidotomy.
Excellent, great. Excellent airway plan, thank you very much. Just checking we have vascular access.
Yes, good access on the right side.
And lastly, we're just going to check our drugs. So for our induction agent, we're going to use 100 milligrams of ketamine. For our paralysis agent, we're going to use 100 milligrams of rocuronium. And then we will get our post-intubation medication set up. We'll probably use a propofol infusion in this instance.
Sounds good.
Right, any concerns?
No.
Is everyone happy to proceed?
Yeah.
Cool.
Okay, we'll get the drugs given now. Can you please give the 100 milligrams of ketamine?
Ketamine's in.
Could you give the 100 milligrams of rocuronium, please?
Cool. And I'll just give it 60 seconds and then I'll have a look.
Yep.
And we'll start the timer now as well. Cool. So it's been 60 seconds, Matt. Are you happy if I have a look?
Yes, please do.
And so it's still 100, just let me know if it dips below 90. So Paula, thank you. So if you give me the Glidescope, and when I'm ready, could you pass me the bougie to my right hand? So I'm gonna have a look first with direct view, and then I'll have a look at video. So I've already got a good view there. I'll just see if I can bring the epiglottis down. That's better. So I've got a grade 1 view. Bougie to my right hand, please.
Thank you.
It's got a nice curve on it. Yep, so bougie through the cord. Could you railroad the tube over the bougie, please, Paula? And tell me once you've grabbed the tip of the bougie, and I'll grab the tube off you. You got the tip of the bougie?
Yeah.
Cool. I've got the tube. Railroading tube. I'm just going to give it a bit of a counterclockwise twist. That's feeding nicely. Lines through the cord. And bougie out, please. And cuff up. Thank you. And we'll connect the bag valve up. I'll just remove the mask. Do you mind holding that for me, Paula? And I'll connect and try a breath. Cool. So we've got good chest rising. Looks like there's good CO2 trace. So I think we're ventilating okay. Is that still fine?
Yes, that's been 900 per hour.
Perfect. And we are currently 20 centimeters at the teeth. So Paula, I'm happy to hold the tube and bag. Do you mind securing? And then we can get a chest x-ray. We'll hook up to the ventilator. And I'll put an NG tube in.
Excellent. Thank you very much.
Cool. And bagging nicely.